Hello, my name is Emily Young, and today I'll be talking about irritable bowel syndrome. Definition and etiology. Irritable bowel syndrome, or some may call it IBS, is a chronic functional disorder that is characterized by recurrent abdominal pain associated with disordered bowel movements. The disordered bowel movements may include diarrhea, constipation, or both. Women are affected more often than men, with twice as many women diagnosed with IBS in the United States. The exact etiology of IBS is unknown, but experts think that a combination of problems may lead to IBS. Different factors may cause IBS in different people. Pathophysiology. IBS results from a functional disorder of intestinal motility. The change in motility may be related to neuroendocrine dysregulation, especially changes in serotonin signaling, infection, irritation, or a vascular or metabolic disturbance. The peristaltic waves are affected at specific segments of the intestine and the intensity with which they propel the fecal matter forward. There is no evidence of inflammation or tissue changes in the intestinal mucosa. Clinical manifestations. IBS has 4 subtypes, and those are IBS-C, IBS-D, IBS-M. The main symptoms include constipation, diarrhea, a combination of the two, or there are few patients with IBS who fit into the unknown category. Hence, the subtypes that have the C, D, M, and the U at the end. The patient may also experience pain, bloating, and abdominal distension. Abdominal pain may occur after the patient eats something, and it may be relieved after they have a bowel movement. IBS may accompany gastroesophageal reflux disease, or GERD, chronic fatigue syndrome, chronic pelvic pain, fibromyalgia, interstitial cystitis, migraine headaches, anxiety, and diagnostics and testing. The clinical manifestations of IBS must be present sometime during the last 3 months, with onset for at least 6 months prior to the Bristol Stool Form Scale can help determine the category of IBS. As I talked about earlier, there are 4 categories for IBS, and they include IBS-C, IBS-D, IBS-M, and IBS. A diagnosis of IBS needs testing to rule out structural or other disorders. To do this, a CBC and C-reactive protein, or fecal calprotectin, can rule out IBD, which is inflammatory bowel disease, for patients who may have IBS-D. A serologic test may also be done to test for celiac disease. To rule out other colon diseases, stool studies and colonoscopies can be done. CBC, blood albumin, ESR, and occult stools are typically within the expected reference range. A hydrogen breath test might be performed to identify malabsorption, impaired digestion, or an overgrowth of bacteria. The client is asked to exhale into a hydrogen analyzer before and after ingesting test sugar. Positive test results indicate excess hydrogen in the bloodstream from bacterial overgrowth or malabsorption. The nurse should educate the patient to remain NPO at least 12 hours prior to this test, except for sips of water. Complications. As you know by now, constipation and diarrhea can be symptoms of IBS. A complication that may come with the chronic constipation or diarrhea is hemorrhoids. IBS is also associated with a poor quality of life. Many people with moderate to severe IBS report poor quality of life. Research indicates that people with IBS miss 3 times as many days from work as do those without bowel symptoms. Mood disorders may also be a complication that results from IBS. It can lead to depression or anxiety, and depression and anxiety also can make IBS worse. National League for Nursing Competency. The NLN competency that I wanted to talk about today is nursing judgment. Nursing judgment encompasses 3 processes: critical thinking, clinical judgment, and integration of best evidence into practice. Nurses must employ these processes as they make decisions about clinical care, the development and application of research, and the broader dissemination of insights and research findings to the community and management and resource allocation. The use of sound professional judgment in nursing education involves the processing of information, thinking critically about it, evaluating the evidence, applying relevant knowledge, using problem-solving skills, reflecting and using clinical judgment to select the best course of action with regard to educational issues and strategies. Question for the audience. What are some non-pharmacologic dietary modifications for IBS? Select all that apply. A. Avoid lactose. B. Increase caffeine intake. C. Avoid specific dietary triggers. D. Decrease fat intake. E. Avoid artificial sweeteners and fructose. F. Increase fiber intake. The answer would be A, C, D, E, and F. It would not include B, to increase caffeine intake, because you should decrease your caffeine intake. So now I'm going to share with you guys my digital poster. So I'll go from left to right and just kind of read everything. So, irritable bowel syndrome. What is IBS? IBS is a chronic disorder that is characterized by recurrent abdominal pain that is associated with diarrhea, constipation, or both. The types of IBS are IBS-C, IBS-D, IBS-M, and IBS-U. With IBS-C, constipation, hard or lumpy stools greater than 25%, loose or watery stools less than 25%. IBS-D, diarrhea, hard or lumpy stools less than 25%, loose or watery stools greater than 25%. IBS-M, constipation and diarrhea, hard or lumpy stools less than 25%, loose or watery stools less than 25%. IBS-U, constipation and diarrhea, hard or lumpy stools greater than 25%, loose or watery stools greater than 25%. Common symptoms include constipation, diarrhea, mixed bowel habits, mucus in bowel movements, feeling of incomplete bowel movements, looser and or more frequent stools, abdominal pain, and bloating. Foods that are safe to eat would be fruits such as clementines, blueberries, or cantaloupe, vegetables such as carrots, lettuce, or olives, legumes, nuts, and seeds such as peanuts, almonds, or chickpeas, dairy such as coconut milk, kefir, or hard cheese, proteins such as salmon, eggs, or chicken. Foods to avoid would be fruits such as apples, peaches, apricots, or pears, vegetables such as asparagus, artichokes, or snow peas, legumes, nuts, and seeds such as cashews, pistachios, or hazelnuts, dairy such as lactose, ice cream, or wheat products, or other items such as tea, high fructose corn syrup, or agave. Thank you guys for taking a few minutes out of your day to watch my presentation. I hope you guys take something from it and it sticks with you forever. Just for a fun little activity, I included a game on my digital poster, and if you haven't noticed already, there are poop emojis. Everybody loves the poop emoji, and I included 13 on my digital poster. So if you guys have time and would like to play, then you can go and try to find all 13 on my poster. Hope you guys enjoyed. Have a great day. See you next time.